This weekend at Ashley's Memorial Day Early Access Sale. Find amazing deals with free and fast doorstep delivery. Plus, get 5 years special financing with absolutely no money down. Friday through Monday only at Ashley.
You know, it's no secret probably to anybody watching that we live in very highly stressful times. Whether you're watching this morning and you happen to be in your 80s or you just turned 28, the fact is that life can kind of get away from you before you know it, which is why it's so good that within our medical community, so often we have a month dedicated to a different type of health concern. This month happens to be Stroke Awareness Month, and so we're very pleased to have Scott Rowe join us. He is with Encompass Health Rehabilitation Hospital, and Kimberly Arterburn is also here. She's with the American Heart Association, so nice to see you both. And I realize, Scott, I'll throw this to you first because I just got through talking about stroke awareness, yet Kimberly is with the Heart Association.
Right.
The two go hand in hand.
They do. The American Stroke Association is part of the Heart Association, and we have been working closely with the Heart Association for several years, both on a national level and a local level, because of our focus on treating patients and helping patients recover from stroke.
Okay, let me start then with the optimistic side of things first, which is that the treatment when you have a stroke has come so far. What you can do.
Most definitely. And of course, a key to that is getting treatment early. I mean, seconds and minutes matter, and so that's why we're so focused on the warning signs. But unfortunately, some still experience those effects of stroke, and it affects everybody differently. For those who have some of the more severe strokes and have physical deficits or cognitive deficits, inpatient rehab is kind of the best option to help them recover and get back to doing things that are important to them.
There is something, Kimberly, about thinking, oh, this can't possibly be happening to me, and when you have a bit of a crisis, an emergency, you kind of freeze up. So remind us what the EASY acronym is for those warning signs for a stroke.
Yes, so we love to encourage people to spot a stroke fast, so FAST. F for facial recognition, so noticing if someone's face is drooping. Same thing for A, arm, asking someone to extend their arms. Maybe they're having difficulty to lift one or one is drooping. S is for speech, if someone maybe is having trouble getting words out or can't talk. T is time to call 911, every second counts.
And you should never, I guess, hesitate to call 911, because if you do and it turns out that it's not a stroke, that's okay. At least you have done the right thing to be protective.
Exactly, most definitely. Seconds and minutes do matter, and the effectiveness of many of the treatments really depend on the timeliness of getting access to care.
You brought a prop with you today. You and Kim both were saying it's really important to know your numbers. So is this one of the ways you can monitor your numbers?
That's one of the most important starting at home, having a device such as this to monitor your blood pressure. That's one of the biggest risk factors for having a stroke is high blood pressure. And so just knowing your numbers and seeing if you have high blood pressure and working with your doctor to control that, whether that's through diet and exercise or through possibly medication if needed.
You heard me kind of, I think, kick things off talking about the stress factor. Talk about that a little bit, Kimberly, because people, unless they've experienced it, might not realize A, what cortisol is, and B, how damaging it can really be to you.
Yes, so as we talk about stress levels, it can directly raise our cortisol, raise our blood pressure. Blood pressure is known as the silent killer for a reason. Most of us don't have symptoms associated with it. And so we encourage people to monitor their blood pressure at home. You might have a high blood pressure here and there, but what we're encouraging people to know is have a baseline. We encourage people to monitor their blood pressure for maybe 30 days, morning and night. Take note what triggers high blood pressure. Maybe it's a salty meal, a stressful day. Make notes and then talk with your doctor.
Here in the Tennessee Valley, it's really important that we have this conversation often because they call it the stroke belt, don't they, Scott?
Yes, it's an interesting kind of phenomena, and a lot of that unfortunately does have to do with our diet. There's a higher incidence of obesity in this area. It's just a reason that much more to focus on risk factors and try to control those.
Okay, so let's talk some specifics while I've got you about what you do at Encompass, because you're very proud of this success rate that you see.
Yeah, most definitely. I mean, this is one of, and we treat patients who are recovering from a number of different diagnoses, but stroke is one of the primary things that we focus on. We have a program that's been certified by the Joint Commission for multiple years, and are able to attain outcomes that are well beyond the national average. And so we're able to do that just through the intensity of therapy we provide. And Inpatient Rehab Hospital is, per the American Heart Association, the best place to recover after a stroke.
Well, and what that means is if you've had a stroke and you're there, there is a physical therapist and maybe even an occupational too,
Yes.
I don't know, attending to you, and really whether you like it or not, they're going to see to it, right?
Right,
That
exactly.
you
I
get
mean,
yourself-
that is what makes a rehab hospital unique, is you're receiving the services of a physical therapist, occupational therapist, and speech therapist if needed. And it's at an intense level, meaning 3 hours of therapy a day. Now, that doesn't
Wow.
mean that you're on a treadmill for 3 hours. It's individualized to what each patient needs
Right.
and what they can tolerate.
Isn't that so beneficial though too for their family when they come back home, because that means they're going to be stronger?
Oh, most definitely, most definitely. And that's one of the challenges. Some folks go through a stroke and they're in the hospital and all they want to do is get home. And they don't want to think about going to another place for 2 more weeks. But what I always suggest and encourage is keeping in mind this is the rest of your life. And,
Right.
you know, studies have shown the more therapy and the more intense therapy you can get early on after a stroke, the more likely you are to recover.
And Kim, I know we talked, Scott and I did, about this stroke belt that we live in, but through the Heart Association, you really do see it all. Heart attack and the stroke, which is just the issue going to a different part of your body.
Right.
What is the incidence level here? I mean, does it hit young and old alike?
Absolutely. We see it hitting everyone. And that's why it's so important to know your risk factors, knowing your family history, knowing those levels. Every 40 seconds, someone experiences a stroke. Stroke is the #1 disabler of adults in the United States. And so it's so important to have education around stroke awareness this month.
Okay, if someone's watching and they know somebody who they'd like to see come your way to Encompass, does that have to be a referral directly from the hospital? Or if they've gone home, can they still contact you?
No, because we are licensed as a hospital. We can have patients admitted directly from home, from a physician office.
Okay.
Maybe if they've gone home and have tried home health services and that's not sufficient, we can receive referrals from home health services as well. We'll work with their primary care physician to coordinate that, but they don't have to come directly from a hospital.
Okay, here's where you're going to learn more then about Encompass Health Rehabilitation Hospital on Macaulay Avenue. 698-0221 is their phone number. If you want to just call them and talk to a real life person, you can also learn more at encompasshealth.com. And if you are in a physician's care, then perhaps just mention it to them as well.
Yes.
Thank you both so very much.
Thanks for having us.
Order in the app for half-price cheeseburger.
One Sonic cheeseburger coming right up.
I got the ketchup.
Putting on the pickles.
Order up.
Half-price Sonic cheeseburgers every Tuesday night. Only when you order in the app.
You only get so many opportunities to follow your dreams, to make your mark in this world, to lay the foundation for your future. So never stop dreaming, creating, advancing. At Chattanooga College, we prepare our students to make their mark in programs like cosmetology, manicuring, aesthetics, or as an instructor. Find out more about these exciting cosmetology fields at chattanoogacollege.edu. Chattanooga College, because a small college can make a big difference.